Good afternoon. Welcome back to Highlights. Today is our taping of our November show, and we have a special guest today. We have Katrina Wilcox Hayburg, and she is an epidemiologist, and she's here to talk to us today about COVID and where we stand in Littleton. So take it away, Katrina.
What would you like to know? Thank you for having me first.
Well, you could give us a little background on what you do and why.
So I am a Littleton resident, and I am actually a chair of the library trustees, so I've been around town. I'm an epidemiologist, and for the last year I've been volunteering with the school committee and Board of Health to help track COVID metrics here locally.
I've seen you on both of those. I do try to watch both of those. And your information that you give on those is, I think, not only valuable to them, but it is to the general public too. What is currently happening in town, according to about COVID cases, or?
So in the last few weeks, we've had an increase of cases. So over the last month, we've had a week-over-week increase in cases. According to the Mass DPH, the last 2-week period, we had 52 cases in those 2 weeks periods, which it seems like small numbers and it's easy to dismiss, but that is the same level we had over the holidays last year between Thanksgiving and New Year's. So we're technically in a spot where we are having high community transmission rates. And over the last month, we've actually had 10% of all of our cases have occurred in the last month. So it's a time to just keep an eye on things and to be careful and use as many precautions as we can.
So that 52 cases that you said over the last 2 weeks, that's an increase of how much, like from before?
So the
roughly
2-week period was 52 last week, and 2 weeks before that we were 36. So we kind of went up from 25 to 36 to 49 to 52. So we've had this series of increases. I will say the last 2-week report was slightly higher. It wasn't a big jump. So hopefully we're kind of keeping a cap on things right now. Now that we saw transmission get up, we sometimes will halt for a little bit, and hopefully we'll see some declines soon.
Okay.
Is there a particular age group that the 52 cases are in, or is it spread all over?
It seems to be spread all over. When we hear about contact tracing, it's all age groups. There are some that are in schools, but the schools are testing. They're looking for cases there to help prevent onward transmission. So there were, over the same 2-week period where we got the 52 cases, there was a notable jump in the number of school cases. But if you look at the proportion of residents in the town that are school age versus the rest of town, it was only slightly higher in those age groups. So we know that household spread's a big deal. And so it probably came back to households and families and then can travel from there. When you look at contact tracing, if you listen to the Board of Health meetings, they're seeing transmission following some of the potential routes we've been told about are schools and workplaces, social gatherings, concerts, sleepovers, things like that. So where people are gathering and maybe a little more comfortable and relaxed around people, that's where COVID really spreads easily.
And as far as the seniors go, what is do you have figures on the vaccination rate for seniors in town?
Yeah, so the Massachusetts Department of Public Health releases a weekly report on the vaccination status by municipality. So here in Littleton, we have 85% of our residents who are 65 and older are fully vaccinated, which is great, but that leaves 15% of our seniors who are either partially vaccinated or unvaccinated. And another age group that is of concern is the 50 to 64 age group. Again, 85% of those individuals are fully vaccinated, but that's actually a large proportion of residents in that age group, so that's a bigger group of people who are unvaccinated. So in total, when you look at the state data, there's around 600 people age 50 and older who are either unvaccinated or partially vaccinated that we would hope would get vaccinated soon.
We need to spread the word to get out and get vaccinated, especially for that that age group?
Yeah, that age group is, I think, really important. The risks for COVID are really elevated for seniors, or as you increase in age, the risks get much more severe. And a 50-year-old has something like a 6 times higher risk of death compared to a 30-year-old. It's a big jump there. And so it's really important for everyone in this older age groups to get vaccinated for their own personal protection and also to not spread it to others. So.
Right, that's a good point, because you always hear get vaccinated, obviously for yourself, but also for others in the community and your family. But in that age group, or in the as everyone ages, it's more important to get it for yourself too, than just that other group. If you were going to give some advice to people on something simple and easy to understand, where would you go, or where would you suggest we go for some information on COVID, for Littleton specific or in general?
So I welcome you to watch any of the board meetings that I'm on, where I'm trying to present the local data to help people understand community transmission patterns, but also how to protect yourself, what you can do to lower the risk of getting infected in the first place. The other place that is really important is to actually talk to your personal doctor, your nurse, your pharmacist. They have been trained in COVID risks and specifically how that would relate to you individually, and how to protect yourself individually compared to your personal history. So if you have questions about those vaccines, and which one might be right for you, and given your health history, that's a perfect place to go talk to get information.
Okay. On the 52 new cases, do you know whether they were vaccinated breakouts or if they were brand new who hadn't had shots?
It's a really great question. It appears that about half were unvaccinated and half were partially or fully vaccinated, so had some vaccine. So it doesn't surprise me. We have 85% of our residents have been vaccinated in your age groups anyway. So 75% of all residents of all ages have been vaccinated. So it doesn't surprise me that we're seeing breakthrough cases and then we're seeing them reported. It's expected, but it is not just in unvaccinated people. So everyone should be taking some precautions to protect their health.
And when you see these new cases breaking out, have any of them been hospitalized?
Unfortunately, the town-wide data doesn't give us that kind of detail. Oh. So I am not personally aware of if any have been hospitalized. I'm sure there have been some hospitalized, just because that's how it works.
Right, a certain age group is the situation where there's possibility of.
But the state does not provide hospitalization and death data by municipality for COVID.
Mm-hmm. And now that the boosters are out for all 3, I guess, really, it probably is, or your recommendation definitely would be to talk to your doctor or some health provider as to which one you should have, because following the news, it gets confusing.
I completely agree with you. It is completely confusing. The recommendations currently are that people who are age 65 and older should get a booster. Well, they should get vaccinated, but then if they've been vaccinated and it's been, so if you've had Pfizer or Moderna, 6 months since that initial series, then you should get boosted. If you had let me back up. If you had J&J, if you've had it more than 2 months, you should get a booster. So depending on which one you started with, it's either 6 months for Pfizer or Moderna, 2 months after for J&J. But the recommendations is individuals 65 or older should get a booster. Individuals 50 or older with an underlying condition should get a booster. Individuals 18 and older who have an underlying condition or work in a setting where they have a higher risk for exposure, that could be schools or various businesses where it's just you're expected to come into contact with people. Those you may get a booster. They're not required right now, but it's one of the recommendations that you can if you choose to. And I do think your doctor is the perfect, or pharmacist or nurse is the perfect person to reach out to say, I got this initial series, which is my best choice for the next one.
And do I really fall into one of those
Yes.
categories?
Yeah, and it will depend on your underlying health, your risk
Right.
tolerance, who's around you. If you're living with someone who's immunocompromised, you may want to get a booster sooner or as soon as you're eligible, just to help protect your household.
Right. Oh, that's a good point, too. Also, it seems that boosters are going to be easier to get than when we were way back in February and March trying to make appointments and all of that. The boosters seem more available, more easily available.
Yeah, that is the hope, I think, is between pharmacies and doctor offices and local clinics. I know the town has been bringing clinics. The Vax Bus was here. There will be a clinic coming up in November for boosters and also initial shots for hopefully 5 to 11-year-olds soon.
Right.
But yeah, the hope is that as you become eligible, it'll be easier for you to find an appointment to get the booster of your choice.
Right. Right.
And when would you suggest people get tested?
Oh, that's a really great question. So testing, I think, depends on who your exposure risk and what you're doing. So, for example, our kids are getting tested once a week in schools, which is great for that. They're in a setting with lots of people all the time, long durations of time, so it's great that they can get tested at least once a week. I think it will then depend on if you're out and about and your exposure risk. So if, for example, if you went out to a large gathering, and if you know you're with people who are all vaccinated in your age group and your health, like if you are all gathering together for a dinner, say, you might ask people to do one of those over-the-counter rapid tests before they arrive, just to make sure no one's actively contagious at the time of the event. And then it would be advisable to do another one a few days later to prevent any onward transmission. So I don't know if you've seen those Binax Now or over-the-counter testing kits.
Yes.
Those are real. The rapid antigen tests are really great about helping to tell you, am I contagious right now? And they take 15 minutes. You can do them at home. And if you are positive, then you should follow up and get a second confirmatory test.
That's really good because sometimes it's hard to get an appointment to get tested, especially on the weekends.
And it can take a couple days to get your results back, which means it may not be useful.
Right.
I know I've put a couple of those Binax Nows in my closet, and it's been great for like a kid has symptoms and we're going to go visit grandma. Like we just want to make sure that we don't accidentally bring something to them when we can prevent it. I know for Thanksgiving, we have, I want my unvaccinated child to be able to, see his great grandmother. So we will, at Thanksgiving, we will test everyone in our family beforehand so we can hang out with them at Thanksgiving and not worry about that we're spreading the virus.
Right.
Protecting our older relatives too.
Which is a really good point to make, that just because you're vaccinated, you're not protecting anybody around you.
Yes.
And so that's important, that you can still be a carrier.
Yeah, vaccination does a great job at lowering your risk of infection. It's like 5 times lower risk of actually being infected, and vaccination actually shortens the time frame that you're contagious to other people, so it really does help prevent transmission, but it doesn't eliminate it. It does take a while for our immune systems to get up and running to help fight it, so there's this short period of time where you may actually transfer virus to someone else unknowingly before you're aware.
Right. Right. So the rapid tests you do recommend for that,
Yeah.
for those
I think
kinds
they're
of
a great
reasons.
tool.
I think that's right.
And especially if you're using them selectively to socialize with friends
Right.
or
Right.
family in a safer way. Like all we can do is make things safer. We can't eliminate it, but we can make it safer. And there are you could wear masks, you can open windows, meet people outside. Like there are other things to do to help lower those risks too, if depending on who's at your gathering and how.
And for how long.
How
or
long, or
just
things like that.
Whatever.
The other scary thing is too, some of the symptoms of COVID are just like a cold or the flu. And so if you've got a headache and you don't feel good for 2 days, and you might have the flu, but you might not. You might have COVID, and it's because you've been vaccinated, maybe that's all you're going to have is a symptom, but you really are contagious.
Yep.
It's hard to know.
It is very hard to know, and I think that's where those rapid tests are very useful. If you're symptomatic and you are planning to go somewhere but you aren't feeling well, it doesn't take long to do a quick swab and say, okay, this is giving me information that I'm not actually contagious right now, and then you could go about your day.
Right. And speaking of the flu, you recommend flu shots for everyone
Absolutely,
too.
yes.
I assume.
The flu is actually circulating in our state. It's at a very low level right now, but it is here. And given that we're all out and about and socializing again and in public places and around people, we're just expecting more colds and viruses to circulate. So it does not hurt to get the flu vaccine.
Right.
And some places are saying that you can get the vaccine and the flu shot at the same time.
Yes, you can get your COVID vaccine and a flu shot at the same time.
Yep,
Okay.
you can.
Stop shopping.
Right. My husband did. He got both at the same time.
there you
One in
go.
each arm.
Yeah.
You got it taken care of. What would you say to someone who is still on the fence back to the whole idea of getting vaccinated at all?
All right. Yeah, this is the group this is important, and I really hope everyone who is currently unvaccinated will seek their doctor and have a true conversation with them about your risk, your health, and the vaccines, because not being vaccinated carries a much higher risk of infection. Like I said, 5 times higher risk of infection than an unvaccinated person, but over 10 times the risk of hospitalization and death, especially for these older age groups. So if you're not vaccinated right now, I highly recommend you get vaccinated, seek vaccination, seek someone to answer any questions you have. And especially as we're talking, we're going into winter, we're going into indoor environments more. That's where we're going to be for the next few months. And COVID is airborne, and it really spreads when we're inside. And you can try to do everything you can to lower the risk, but the best tool we have is vaccination. And that is the best way to protect yourself individually and those around you. So I really, really hope, and I was just thinking like the holidays coming up, being able to have that layer of personal protection in place before we see hopefully our wider group of people and enjoy the holidays together,
Right.
That would be really important. So I really encourage anyone who has not been vaccinated yet to get vaccinated.
One of the things that has been concerning to me is nurses who have been in the line of duty with COVID are not wanting to get the vaccine. Do you have any sense of why? Like a nurse or a doctor who knows the risks and knows the situation, other than if it was a religious reason, why they wouldn't?
I personally I haven't had a conversation. I don't actually know anyone who's in that group, I'll be honest. I think there are people who will have objections to that kind of a requirement to have a vaccination based on employment or whatnot. And I can understand that, but I don't understand not wanting to protect yourself and your family. And that's just my personal opinion on that. So I do hope most people aren't falling into that category.
Right.
Yeah.
Right. We hope.
I hope.
We have to hope
We
that
hope
way.
so. We have to hope so too.
Yeah.
Do you have any other?
The one other piece of that is, just thinking about it, is there are, those people, our medical care providers have been in the front lines of this from the beginning, and it's possible that they've already been infected too. And so there is probably, natural immunity does provide some protection against COVID. So there could be the people who, in these jobs, who have already been infected and are like, I'm fine. But the studies are showing that natural infection plus full vaccination is really protective against COVID, actually more so than just only getting vaccinated. So I don't want people to go seek COVID infections. That's not what I'm saying. But if one of the reasons you're not getting vaccinated is because you've already had a prior infection, it's really important to follow that up with a vaccination to really boost your immune system to respond to the next phase of COVID.
Right.
Now, with the Delta virus going through, do we see anything else coming to the forefront? Like the Delta virus was, so contagious and coming on and giving everybody a certain scare all over again. Is there anything in the pipeline that says there's another one of some sort coming through for the winter?
So the more that there are infections, the more likely that COVID is to mutate and create new variants. And then these new variants may have an advantage for spreading or severe disease over the ones we currently have. There is recent news of a Delta Plus coming out of the UK that they're looking at right now. And I don't know if it's worse than Delta. It's a Delta variant with, I think, 2 more mutations in 2 specific spots, and they're keeping their eye on it, and they're concerned that it could be more transmissible. And if it's more transmissible, Delta's already very transmissible, so we should really be doing what we can to try to protect ourselves from spread. So even though we're vaccinated, that's where the masks come in, that's where getting yourself tested when you're out and about. These are all things we can do to help kind of try to keep our hand on spread from keeping it from getting out of control. All these things help to just reduce the number of people who might become infected if Delta enters any situation.
Well, a year and a half ago, or whenever this first started, and the talk on the news was to flatten the curve.
Yeah.
Well, Littleton needs to get the curve going down.
I would
right?
love to see it go down, and I do think that we have 75% of all of our residents from all ages are vaccinated right now. So we have that's our major tool, and we've got a large proportion of our residents who have at least gotten an initial vaccination. And that, I think, helps when COVID gets kind of going in those settings to put up roadblocks and to slow it down some. So that definitely brings down transmission to a lower level. And then other things, just not going out when you're sick, and like we said, testing before you go out into large social situations or coming out of it. If you go to a concert or a performance or town meeting, maybe do a rapid antigen test in a few days just to make sure that you didn't pick something up along the way. And that just helps prevent onward transmissions. We're just keeping our rates lower. And the less chaotic things are, the more people are confident going out and enjoying life and seeing people and shopping in our stores and sitting in our restaurants. So we want to keep Littleton open and social, and so we can really protect everyone's mental health, physical health, and just our community as a whole.
And then once the 5 to 11 age group gets vaccinated, we'll all feel a little more comfortable too, and that will help our statistics, but it will still mean those ideas of testing and so forth are good ones.
Yeah,
too.
I have a 9-year-old, and I will be getting him vaccinated when he's eligible.
First
My
in
12-year-old is already vaccinated. I will definitely be there. But I do have to say our schools are using every tool at that they can access to reduce spread. So our schools are doing a great job trying to make sure that anything that does happen in schools doesn't end up back out in the community. And the community is doing a good job trying to make sure we don't get have clusters in our schools. So
I think Littleton's done a good job of that.
Yeah, they have.
Right.
Yeah.
Maybe other school systems, not so much, but
we're very lucky to
here.
be in Massachusetts, where we have that test to stay program, where if they are a close contact in the schools, they get to stay in school, but they also test every day.
That's what I didn't understand until 2 weeks ago at the football game in Littleton. Dr. Clunchy came over, and we were talking about COVID and in the schools, and a friend of mine's son had been sent home because some kid in his class had been exposed to it, didn't have it, but exposed to it. And he said that it was that stay in place, and he explained that test so that the kids could stay in school. And I was amazed that they even have that test.
Right.
And very impressed that Littleton has it, and it can keep, because the kids need to be in school.
They do need to be
They
in
do.
school.
They
absolutely
really need to be in school.
And for a quarantine for an unvaccinated child, who right now is all children under 12, it can be really disruptive. Like if they're unvaccinated and they're exposed outside of a school setting, they are unable to return for, I think, 10 days.
And they've just gotten back and started to get into a routine.
Oh, yeah.
And then they're kicked back again, and it's just,
Yeah.
So
getting that age group vaccinated will help protect the schools. It will also limit disruptions to education and activities and their families, bringing it home, household spread,
It
things
will
like that.
affect the whole community again.
It will absolutely impact the whole community.
It will definitely go back to that idea of get it for yourself, yes, but also get it for the whole community.
Yeah.
Get your vaccine.
I mean, infectious diseases are community level
They are.
commitment to try to control. We can't eliminate it, but we can do what we can to reduce the spread and the impact.
That's true.
do you know if the Board of Health is looking into any ways of putting out some kind of informational knowledge to the 50 and 60-year-olds to push that effort to get those people vaccinated? Is there any kind of an education drive, or when the van comes, just really push. Is there anything like that going on right now?
So Littleton has created a COVID working group, which has, I actually sit on with members of the Board of Health and the school committee and the town administration, the select board, basically everyone. Liz is on that as well. And we've been working for a few months to try to increase vaccination access and knowledge, basically. But so that's why the Vax Bus came for 2 visits now.
Right.
And that's, Liz has done outreach among the Elder and Human Services Department, has been calling people just to make sure that if it's not anyone who wants to be vaccinated has had a chance to, and they can't help with boosters or whatever too. So so we're trying to get the words out, and I know when we're anticipating the 5 and 11-year-olds will be authorized to have the vaccines soon, and the town administrator has organized a clinic for that age group and also boosters at the same time. That will be coming in November and December. So they have been very active in trying to schedule these clinics ahead of time to bring vaccines to our town to make it easy for our residents to get vaccinated. So education and information will be coming out about that as soon as we are able to. But yeah, that 50 to 64-year group, I'm not quite sure how to reach that group. So if anyone has ideas, information about how to just talk to that age group, I'm all ears. I'm happy to go talk to anyone, anywhere. We've talked about maybe doing a table at the next football game, just to raise awareness.
That's this weekend.
I think,
It's
the 29th.
Friday.
Yep.
Yeah.
I have to follow up on that, but yeah.
Now, it's true that reaching that age group must be difficult because, well, probably many of them don't have kids in the school. I mean, some do, but but probably the majority may not. And so you're not appealing to them through the school aspect of it.
And I think that's part of the difficulty for that age group.
And so there's sort of that group and then they're not in the senior group, and they certainly don't ever want to consider themselves in the senior group.
We've been told that.
We know that, but so that is an age group.
I think it's generally an age group that's hard to target and to reach out to for any health outreach.
Anything.
But yeah, I'm not quite sure how to get to that group here locally, and if anyone has ideas, reach out to the Board of Health or any of those groups. Actually,
and a lot of those people probably are not working in businesses in Littleton, because if they were working for businesses in Littleton, the businesses could have a seminar.
That's true.
And just say, today we're meeting for half an hour and just want to talk to you about X, Y, and Z and stuff.
Right.
Where they're probably all traveling out of town, or they're doing virtual or whatever.
Yeah.
So you may not be able to reach them.
That's another good point.
It is hard these days. I find with a lack of a really solid local newspaper.
Right. We don't have one of those.
I think we've all, I've worked for the library, you guys are the COA. I think you guys know it's hard to spread information out there now.
Absolutely.
It is.
Because we don't have a centralized source. And I know the town has worked with some press releases, things like that. But if that is a concern for how to get information out in our town, it's not just COVID, it's everything. So if there's a way to improve that, that's a really good point.
We need a weekly news program.
Well, there's so much social media and Facebook and everything else out there. If we had a daily newspaper or a weekly newspaper online that just hit the things that were prominent and most important for that week in that town, for Littleton. All right, this upcoming week, these are the important things, and don't forget, get your COVID shot. This is where you can get it.
I would love to see a news source like that in town. I miss having a real local newspaper.
The newspaper's terrible.
Yeah.
Not that we want to be nasty to newspapers, but they are.
Yeah, we don't have a news source. I mean, we're not the only town that is suffering
we're not
from
suffering.
that.
No, we're not alone.
No.
We're not alone in that, but it's difficult to get out information, and especially if you're trying to target, in this case, a specific age group. Not that they're the only ones, but I mean,
And this age group isn't, like you said, tied to schools, tied to COA, tied to other, as a whole group, they're not tied to one specific thing. So it does make it harder to get information out to them.
Do you have any other questions?
How is the nursing home doing?
Oh, yeah.
The nursing home. So I have to say I don't have exact numbers on that. That's something we can ask the Board of Health. But my understanding is, unlike the spring, where all the cases, spring 2020, not even
When
the
it
spring.
started.
When it was
when
bad,
it started, where all the cases were in the nursing home. They have had some breakthrough cases or cases there, but it hasn't been to the same extent as it was back in spring 2020, which I'm very grateful for.
Right. That's when it started, and
Right.
It was heartbreaking.
We all
it
did.
was, and nobody
Yeah.
really knew
We didn't
how
know what
to-
was going
how-
on.
And we didn't have the vaccine then.
Right.
It was quite a while later before we got the vaccine.
Yes.
Do you have anything else that you want to talk about?
Lots of things I could talk about. I just want to encourage everyone to get vaccinated when they become eligible. If you haven't started your vaccine yet, please go get vaccinated. This is the best way to protect yourself. And then if it's time for a booster, please go get your booster. That will help protect you going into this holiday season and winter season, which is really important as well. So please consider going to get vaccinated.
Okay. Well, we thank you very much
Thank
for
you so
coming.
much.
And this has been fun.
It has been fun.
just
Thank you for
have
having me.
Just a nice little conversation.
It's been fun, but it's also been very informative, I think.
Extremely informative.
I've heard a couple of things I didn't know today, so that's really good, and we really appreciate you coming. And if you feel the need to get information out and you want to use our show to do it again, please just give us a call, and you're welcome anytime.
That sounds great. Thank you so much for having
Whatever
me.
you need.
Right. Hi. Since our program was a special guest, or at the beginning of the program we had a special guest, we're going to be shortening up our announcements of upcoming programs and events. So remember to check your broadcaster for ongoing support group meetings, exercise programs, blood pressure and podiatry clinics, and all of the other fun activities. There's a lot going on at Littleton's EHS COA.
And please remember to contact Amy, the outreach coordinator for rental assistance, mortgage assistance on deed-restricted properties, the child care subsidy program, the fuel cost assistance program. And speaking of fuel assistance, if you do not fall within the income guidelines for fuel assistance, you may be eligible for the Good Neighbor Energy Fund through the Salvation Army. So please, please contact Amy to schedule an appointment to complete the application.
When you hear all those things listed, there's a lot that EHS COA provides.
Oh, without a doubt.
You know, in addition to the things we're going to talk about now. As winter approaches, we should all be ready for unexpected emergencies. The Littleton Rotary Club has emergency kits available to seniors and those under 60 with a disability. The kit includes flashlights, batteries, Band-Aids, whistles, and window beacons, among other items to help in an emergency. So be sure to call the EHS COA office at 978-540-2470 to receive a kit.
And in November, we celebrate Veterans Day on November 11th. For veterans, there will be a casual breakfast at the Senior Diner on Wednesday, November 10th at 9 a.m., sponsored by River Court residents and the Friends of the COA. Call to RSVP that you will be able to be there.
Okay, and so that's the Veterans Breakfast is on Wednesday. On Thursday, November 11th, at 11 a.m., there will be a ceremony at the Common, followed by wreath-laying visits to the old burial grounds, the World War I Memorial at Shattuck Street, the Historical Society building, which is a Civil War memorial, Beaver Brook, and West Lawn Cemetery. So hopefully residents will attend those ceremonies.
And the veterans in Littleton should also note that Littleton's Veterans Services Office provides assistance with navigating veterans benefits, financial aid, medical expenses, assistance, burial assistance, the Veterans Work-Off Program, plus other areas for help. and you can call John Borowski at 978-540-2485 to make an appointment to do that.
Okay. And the month of November has some interesting events that will allow you to get out of the house and get together with friends. Are you ready for some music? There's an in-person music experience, the political and romantic songs of World War II. That will highlight some of the songs that were most popular during the war years, songs of love and separation, as well as those tied to events of the war. That event will be on Monday, November 29th at 10:30 a.m. in room 230, and call to register.
And do you want to make a cozy cup of tea in this cold and damp and crappy weather?
Absolutely.
You can attend the Herbal Teas and Infusions workshop on Thursday, November 16th at 11 a.m. in room 233. Learn how to blend and make herbal teas, water fusions, and infused olive oil. Everyone leaves with recipes, drawstring tea bags, and infused oils. The cost is $10, so call to register.
And then, do you need some fresh air plus exercise? Well, meet Nicole at the entrance to Prouty Woods off of Wilderness Road at 10:30 a.m. on Wednesday, November 24th for about a mile round trip walk down to Long Lake. Wear comfortable shoes and bring water, and again, call to register. That's the day before Thanksgiving, so you can get your exercise in before a big meal.
And that is a really, really brisk walk.
Yes.
It is. So coming back, you're all uphill, so be prepared. Of course, there is the ever popular craft class held by Sue and Anita.
And Kathy.
And Kathy, and that will take place on Wednesday, November 10th, from 1 to 3 in the multipurpose room. And this month, the project is a wicker wall decoration with painted pine cones and leaves and other fun things. The cost is $3, and the class is limited to 16, so please call and register. You can call at 978-540-2470 on November 1st.
And that's the same number for all of those others that we have said, call to register. Do you want an evening program with your family? There is a Littleton Lyceum program on Friday, November 5th at 7:30 p.m. at the Littleton High School, and it's called Raptors Birds of Prey, presented by naturalist Maria Isaac, and she will have live birds as a teaching tool. So get your ticket online at littletonlyceum.org.
Well, we've come to the end. So thanks for watching, and we hope you gained some valuable information about the issues facing all of us in Littleton. And remember to check with the broadcaster for specifics on all the programs and events offered. The broadcaster is available online in the Elder and Human Services Department under the newsletter tab. And many thanks again to Katrina for all of her information.
That was excellent information, and it's all good. Thank you.